We are now going to have the budget hearing for social services. Renee, it's good to see you. I'll give you an opportunity to introduce who you brought with you. And but first, before we go there, I just want to say what a pleasure it has been to work with you over the past several years on the Homeless Commission. You all do incredible work for our city, and I'm very grateful. So I'm going to turn this over to Talia to kick us off. And I want to just also highlight the fact that we still have Council Lady Erica Gilmore with us today, and we also have Councilman Bill Pridemore, who is the budget chair, with us today, and we appreciate them both being here.
Okay, we have before us the Social Services Commission. They oversee programs relating to poverty assistance as well as coordination activities in the county. They have a current metro budget of $7.9 million, and they receive about $800,000 in grants and a small amount in other funding. They are currently budgeted at 75 FTEs. They have a budget request today for some Homeless Commission enhancements that they will be discussing for you today, Mayor.
Great.
So, Renee?
Thank you. And thank you for your comments, Mayor. I truly appreciate it. I have to my left Will Connolly, who is the Director of the Homelessness Commission.
Another rock star, I might add.
It's not fair.
And to my right is our CFO, Lisa Ricketts.
Absolutely.
Yes, we are requesting 3 improvements with the Homelessness Commission, and I'm going to turn it over to the Director to talk about those 3 improvements.
I will.
Thank you. So the first position is a data-oriented position, and the idea behind this position is that if we're really going to end homelessness, we have to do a better job at handling data, collecting it, utilizing it, and so this position would help us define the scope of the problem more effectively. So how many folks in our community are actually experiencing homelessness, and what are their individual needs, and then aligning our response more effectively to the folks that are in our community and experiencing homelessness.
So Will, having spent some time on the commission, I know that there are lots of different databases and ways to collect information. Does this consolidate those? Is this new and different? Tell me about that.
It wouldn't consolidate the databases. It would help us evaluate what's going on in our system. So right now, a lot of our program evaluation and our data collection is kind of a program by program endeavor, and we want to kind of go from that program focused approach to a more systems level approach, so that we're setting.
I've heard those words before.
Yeah. So that we're setting performance standards and benchmarks across the system instead of just program by program, because we have a lot of good programs, but we don't really operate as a homelessness system.
This would be a person.
This would be
an FTE.
One data geek that we would have that just focuses on data in the homelessness system, and this person could help support that database that you're kind of mentioning, HMIS, Homeless Management Information System. So MDHA, one of our important partners, operates that database, and so this position could help support that database if MDHA wants and needs that help. And I think
but if we're trying to get everybody talking to each other, this position would be somebody who could bring all of these conversations into one place where we could actually look at the systemic.
Right.
And would there also be an opportunity for outcome-based decision-making on this?
Yes. Yeah, and I hope in a year or less, we'll also be doing some predictive modeling around, all right, if we spent our money in this way, we would get a bigger impact than what we're doing right now. I think some of our decisions about what we fund are based on anecdote and emotion and not really on data, and so
impact is huge.
Yeah, this position will help us get to a place where we can start predicting impact instead of just funding the way that we've been funding in the past. So, and we allocate at the commission, over $1 million for homelessness programs in the community. So, doing a better job at evaluating what's going on in those programs when we continue to fund them, if and when we do that.
So you guys want 2 FTEs. The first request, I think we've jumped to the third request on this one.
Sorry.
But tell me about the first request, about the position that used to exist.
Yeah, so this position's called hospital to home, or at least that's what we refer to it.
Okay, thank you.
Yeah.
That's all I needed.
Yeah.
But in the mayor's
Yeah,
office,
yeah.
it felt more appropriate for this to be
Yeah.
social services.
Yeah.
So it's not a new position.
Right,
Right.
right.
Just the
It's just a
funding.
continuing funding model. Yeah, I got it.
Exactly.
Yep, yep. No more questions on that. Talia?
No, good. Renee, did you want an opportunity to speak to any of the other part of your budget?
Transition?
Yes.
Just very quickly, our homemaker program has been going through an attrition process over the past 2 years. That program will probably end December of 2016. With the ending of that program, we would like to move some of the funding to our family support unit. If you notice, most of our data that we provided for you in web budget is about program transfers, and that's to utilize the dollars we already have to continue to provide assistance to the constituents here in Davidson County. We would like to use some of that funding for snow meals. The last administration asked during inclement weather if we could provide snow meals for our homebound customers along with our congregate customers. We provided those meals out of our budget, so we would like those meals to continue in case inclement weather hits. So that money would help fund that. We also would like to have additional funds there for our burial services. We are at a point now that we are using a cemetery to bury the indigent, and those costs continue to increase. So we're asking for an additional $20,000 out of that fund to cover those expenses as well. Over the past 2 to 3 years, the community needs evaluation has identified food as a major need for seniors along with families and children. So we're asking to start a food pantry.
Let me stop you right there. We have lots of folks in the community who are not-for-profits who provide food access for folks. Why would we want to recreate that?
What we found is when we have customers come into our building, food pantries are sometimes in certain communities and only for those communities. Second Harvest is a large provider, but again, you have to sign up for those meals at that, so they can give the subsidy to you. It's not an automatic, here you are. What we find when customers come into our location is they're hungry, and they don't know how to apply for food stamps. They don't know, generally have transportation to get to a pantry or a food pantry. So we have some small meals we can provide them from our nutrition program. So to assist them with that gap of getting their food stamps started, to getting them to the next level of when they will have food, we want to provide food for them.
What's the cost and how many would you be able to service?
We're asking for $10,000, and we're looking at 100 to 150 customers that we can provide this for.
Is that on an annual basis? So 150 customers
On an annual
annually?
basis, yes.
And is that how many meals per 150? Is that like feeding them every day? Is that?
It's contingent on how many are in the family. It's contingent on the need in terms of number of days that they might need food. So it's roughly hard to say. To give you an example of what we're seeing is there are families that are coming in with at least 2 to 3 children and might not know how to apply for food stamps, so we help them at that time. And it takes generally maybe 2 to 3 weeks to get those food stamps started. So we try to give enough food to last those 2 to 3 weeks until they get the food stamps.
And there's no opportunity for us to partner with Second Harvest to bring that food in, or to have it, I mean, I'm just, again, I'm not looking for us to create
I understand that.
what a lot of things, I mean, $10,000 is not a massive
Right,
request,
right.
but
And I guess what I see is when people come in there in crisis mode.
Sure.
And it's hard to say, okay, well, if you go over here, to Second Harvest.
But I wonder if Second Harvest could come to us.
And we already do business with Second Harvest in our nutrition program.
Right, so, anyway, just something to think about
Something to
as
think about.
as we are trying to be more collaborative
Yes,
across
definitely.
government and not-for-profits, just trying to find those opportunities to not recreate what already is out there.
Exactly.
And, is it better to give Second Harvest $10,000
And let them
have them
provide
come
the-
in and
refer them
provide the
over there.
services?
And I
Yeah.
guess the other piece of that, and I don't want to belabor this point, but it's generally not enough food that is given by Second Harvest to last those 2 to 3 weeks, and based on the number that are in the family. So we try to make it work.
Sure, but if we had a contract with them,
But if we had a contract
that would be
yes,
that would be different.
That would be fine.
Okay,
yes.
I mean, again, not,
Yes, definitely.
and then when since you mentioned the money that is going away for the homemaker piece, what's the total on that?
Yeah, it'd be worth mentioning to her how much is going away when the
Yeah.
homemaker program ends. That's not in her binder.
Yeah.
And how much you are proposing to reallocate in your budget for other activities.
For this particular year, we're looking at $1,088,000.
Million, okay, and you want to reallocate all of that?
We would like to.
And you've got a detailed reallocation
Yes.
sheet for me to show me exactly where that
Yes.
goes.
And we're going to update that information as well. That was requested.
And that money was from it's money Metro was given,
It's from our homemaker program.
but it's now savings in your budget.
But now
Okay.
it's savings. And the program hasn't ended, so this is not going to be available until December 2016.
Got it.
So, and some other things that we see that the need exists is when constituents experience sudden housing loss, and there's not an organization or somebody to respond to assist those residents. And if you recall, Mayor, you worked with us with James Robertson.
I sure remember.
And we reimbursed the commission for those support services that were provided. So there's a need there. We just want to fill the gap. We don't want to reinvent the wheel. We just want to make sure that people are whole and that we can provide the assistance that Davidson County residents really need in times of crisis.
How many people do you serve on an annual basis?
I can tell you last year, over 3,000 people walked through our door for assistance. 85% generally request housing or related assistance.
And how are we able to do on that?
It's extremely hard. We're constantly extending the MDHA vouchers for people because they can't find Section 8. We provide those other services, but finding housing is extremely hard at this point, yeah.
Got any housing solutions?
I wish.
Is there any reason that you didn't consider reallocating some of those resources toward Homelessness Commission to cover this improvement request?
To cover the, which improvement request?
The 155.
The 155?
Yeah.
No, we didn't think about that. Again, that money is not readily available at this time, so.
Okay, but that is an option.
Potentially, if we're trying to find
Yes.
money.
Yes. Okay.
Well, like I said at the beginning, thank you. I know that you all provide an amazing service for many of the folks who need the biggest safety net in our community, and without that safety net, they'd fall through. And thank you.
Thank you.
Thank you all.
Thank you.
I didn't even ask you, did you have any questions? All right. Thanks, you guys.